Hi, I am Dr S S Honnani, surgical gastroenterologist. Today I am going to speak about acute pancreatitis. Pancreas is a very important organ. It produces juices which will digest our fat and protein. So it is very much necessary organ. It also helps us to produce insulin and it helps us to control the diabetes mellitus. What is acute pancreatitis is autodigestion or damage of the pancreas will happen by its own enzymes. It is called acute pancreatitis. Most common cause of acute pancreatitis in India is either alcohol consumption. Second thing is gallbladder stones. So whenever gallbladder stones slips and it gets stuck at the junction where gallbladder and pancreatic duct enters the intestine. So when this will happen, the bile juice gets seeped into the pancreatic duct and it will activate the pancreatic juice, and pancreatic juice start digesting pancreas itself. It can be very mild. Sometimes it also digests pancreas completely. Also surrounding fat tissue and connective tissue also get digested. Whenever the alcohol is consumed, it will make the pancreatic juice very thick. Sometimes it causes spasm of the ampulla of Vater, where it will obstruct the bile flow and pancreatic juice flow. So there will be mixing of the bile duct fluid into the pancreas and pancreas get damaged. Sometimes alcohol directly causes some free radical injury into the pancreas, can cause acute pancreatitis. You may think that okay, so many people are drinking, why not everyone is developing pancreatitis? It's not like that. Pancreatitis, all people who drink alcohol are risk of developing acute pancreatitis. I have seen people having their first beer developing acute pancreatitis and getting succumb to it within a week. So alcohol is a very dangerous thing. We should be avoided completely, and I suggest everyone that to avoid alcohol as much as possible, because pancreatitis, if it develops, it is a very crippling disease. The severity of pancreatitis depends. It can be as mild as having some abdominal pain like gastritis to as severe as coming to ICU and succumbing to it within 3-4 days. The severity of pancreatitis will differ. How do we evaluate acute pancreatitis is whenever patient comes with a severe abdominal pain which is radiating to the back and they are having vomiting, then we do certain blood tests. Specifically we look for amylase. If amylase is raised, patient is having a typical features of pain, and we'll do an ultrasound scan. Once the acute pancreatitis is diagnosed, we immediately start the treatment. We first grade how severe it is. If a patient has got a mild pancreatitis, we admit him to the ward. If patient is having a moderately severe or severe pancreatitis, we will admit them in ICU. As soon as admission, we immediately hydrate the patient very well. So initial treatment of the pancreas is mainly hydration and control of the pain. If patient has got a gallbladder stones, it is stuck there, we will do a ERCP stenting and remove the stone, because it will help us to relieve the jaundice and also help us to relieve the pancreatitis. Once the pancreatitis is controlled, then we ask for a CT scan. Usually we do the CT scan our 7th or 8th day post pancreatitis. The reason is by this time we will come to know most of whatever the pancreas, how much ever it damaged, whatever the necrosis will be settled in. So you have an exact assessment of how much damage has happened to a patient. So doing early CT scan is not actually necessary. We do the CT scan on 6th or 7th day, so to have a proper idea. Once pancreatitis is diagnosed, once CT scan is done, most of the time initial management is conservatively. Once the patient improves, initially we won't give anything orally. Once patient is relieved of pain and is able to start eating food, then we will plan a diet for him, then we discharge them. So what are the complications of acute pancreatitis? There is varied complications are there. One is patient can develop pseudocyst. There is something called walled off pancreatic necrosis. Most dreaded complication as a surgeon is infected pancreatic necrosis. When a patient has got an infected pancreatic necrosis, most of the time they require necrosectomy, and the survival of this patient is only 50%, because even if extensive surgery, extensive ICU therapy, extensive intensive care therapy, we may lose these patients. What I want to convey you guys is, like whenever there is a pain, especially in epigastric region radiating to back, specifically after having some drinks, or patient is already known to have gallbladder stones, don't ignore, immediately consult your surgeon, take a appropriate advice. And whenever a patient is having a pancreatitis, and every surgeon advises admission, because initially we see patient may be looking healthy, walking around. That is because patients are young, their cardiac reserve is high and all. But I have seen patient walking to the casualty, and within third or fourth day going to ICU and dying in the ICU. So with a pancreatitis treated early, appropriately, will save the life. If a pancreatitis diagnosed, most of my patient I manage IP. The reason is like it's easy to manage, it is easy to avoid the complications, it is easy to hydrate the patient. So if surgeons advise to get admitted following pancreatitis, don't ignore it. It is actually a very important thing. Get admitted. The complications of pancreatitis is varied. We have pseudocyst. Pseudocyst still require around 50 to 60% of the time surgical management or endoscopic management. And these patients with post pancreatitis, if the pancreatic damage is more than 70%, these are the patients who have high risk of developing diabetes in later life. So whenever the acute pancreatitis patient is there, they should be regularly followed to look for any new onset of diabetes mellitus. These patients also have a develop malabsorption syndrome, because once the pancreas is damaged significantly, it won't produce sufficient enzymes, so digestion will be affected. These patients may require lifelong enzyme supplementation also. Pancreatitis is not a very good disease. It makes the person cripple both physically and financially. So don't neglect pancreatitis.